So good evening, doctors. Today we're going to talk about FACETEM. FACETEM is a calcium hydroxylapatite filler that, as you know for sure, it's a product which is naturally stimulating the production of new collagen and new elastin. We use the FACETEM S, which is the one with the right concentration, and we have actually two kinds of syringe. The first one is with 1.5 ml, which is useful whenever you have to give volume to the face, for example, nasolabial fold, marionetta's line, pre-jaw gap, jawline itself. And the other one is 0.8 ml. As you can see, if you can make a zoom, please. As you can see, there is a syringe which is the same, 1.5, but it's filled only for half. Why this? Because this product can be used also as a biostimulation. Today we will see in our beautiful patient how we treat the hands. When we treat the hands, the dilution can be done 1:1, means if we use the syringe of 0.8 ml, we will use 0.8 ml of saline or lidocaine. For the hands, I suggest only saline. And in this way, we will have enough product in order to stimulate the full hands and create a new rejuvenation of the skin. It will take around 3 to 4 weeks to see the final result, and according to the age process that the skin has already, to the wrinkles or to the thickness of the skin, we can plan 2 or 3 sessions within 1 month of interval between them. So let's see now how we're gonna do the dilution. We will start today with our hands. I'm using the 0.8 ml, 1 per each hand, which will be enough to treat our patient, okay? Let's see. So here we have our beautiful Rim, our model for today. May I ask you something, please, yes. Rim? How old are you?
43.
She's lying. She's 36 in the reality. Anyway, as you can see, she has quite dry skin on the hands. I asked her before, are you using a lot the hands? She said, yes, because of my job. So we are gonna do a rejuvenation of this hand. Usually 1 entry point is enough. I will use here the syringe. The FACETEM has 0.8 ml diluted 1:1 with the saline, so in total will be 1.5, 1.6. 1 syringe will be enough to treat 1 hand, so for both hands we're going to use 2 syringes. We could even use the syringe of 1.5 ml diluting with 1.5 ml of lidocaine, and we use 1 syringe for both hands. I like to do only 1 entry point, which usually is this point. It's super easy. You ask the patient to bend the wrist and you feel a small gap under your finger. This is the safest place. We will use a cannula of 21 gauge, 7 centimeter or 5 centimeter cannula, and from 1 entry point we will treat the whole hands. So always we do a nice disinfection of the area, not only the entry point. Let's do disinfection on the whole forearm, okay? We have to be safe. Entry point, so if we ask the patient to bend the wrist in this way, you can immediately feel here a small depression, okay? This is the space between the joint. And there is one more on the radial side, which is here. I'm going to use this one because from here it will be easy for me to treat the whole hand like this, okay? 1 small injection of anesthesia. Always check if there are veins, superficial veins, so we avoid to inject where is the vein. I use lidocaine, plain lidocaine without adrenaline on the hand. It's very important. Do not use epinephrine or adrenaline whenever you inject the hands and feet, okay? Thank you very much. Let's go like this. Can I have the injection of the anesthesia, please? Do you have any allergy?
No.
Have you done local anesthesia before?
Yes.
Very good. So 1 small injection of local anesthesia, it will burn just a bit. It will be 1 millisecond. 1, 2, 3, 6. Suction test. Okay. Nothing. That's good. You good? Fine. Thank you very much. We wait 20 seconds for the anesthesia to work. I make a small bubble. So we did the local anesthesia. I clean the area. I do a small pinch with the needle, okay, lifting a bit the skin. 1, 2, 3. That's it. Pain? Of course, there is the anesthesia, so there is no pain. Okay, and we start with our filler. We prime the cannula. For the injection, the best thing to do is having a full stretched skin. So we ask the patient to go a bit further with the arm. I enter from here. I tilt and I start my injection. Tell me if you feel anything. In this way it will be super easy and smooth. Okay, sometimes the patient feels something because there is a small vein, so we avoid to break it and we go around. You can see I'm reaching already my place. And I start my injection. You might feel a bit of burning, eh? It's normal. You okay? I change the direction, I reach the other place. Okay. I change again. I go close to the interspace between the knobs and I do my injection. Is it good? If you feel a small obstacle, just tilt a bit the cannula and you go through. There you go. Okay? Any pain? Okay, done. Can I have another goes? I will apply all over the hands and we do a nice massage following the radial injection that we just did. We are using an antibiotic ointment, so we are safe. Okay, we can spread also on the entry point. Go a bit back. We do again. You okay? Explain to the patient that if in the days after she feels or he feels some small lump on the surface of the skin, it's just enough to massage in this way.
Lump.
Yeah, if you feel the lump, okay? This is the immediate after result. Can I see the other one? Put one next to each other, look the texture. This is still very, very dry. This one, if you put one next to each other, I think there is already a big difference. It will improve in the next 3-4 weeks. This is, of course, it's an effect that we got because we filled the area. But because of the dilution, our main goal is to stimulate the production of new collagen and elastin. And this one will happen following the normal turnover of the skin, which is around 21-28 days. So 3-4 weeks, okay? Thank you very much. So we just finished to do also the left hand. As you can see, it's a nice result. The skin appears immediately more moisturized, but again, it will improve in the next weeks. Now, very important thing, when we don't have to do any kind of hands procedure, not only this filler, but also the others, this collagen stimulation, but also the others. Whenever the patient has any skin condition, psoriasis, keratosis, skin cancer, precancerous lesion, whenever the patient has anything like that, we don't do any hand filler, any hand stimulation. When the patient has arthritis, we don't do it because we are gonna make the skin better, creating an inflammation. If the patient has already chronic autoimmune inflammation, which is the arthritis, we can cause damage on that. Whenever the patient has a Raynaud syndrome, which is the vasoconstriction of the vessel, we don't do any procedure on the hands. In this case, she's nice, beautiful, and healthy, so you can put all the hands one next to each other. As you can see, they look immediately better, and I'm curious and very happy to see you after 3 weeks to see the final result. Thank you.